Myself and Stephanie Hamilton are here at Rehab United interviewing Julie Barr, physical therapy director.
Hi, this is Julie Barr and I'm Stephanie. We're interviewing from Rehab United Sports Medicine and Physical Therapy. What is your specific job title?
I am the Director of Physical Therapy.
What education does your job require?
Physical therapy requires you get your bachelor's degree, your undergraduate degree, and then that you go to physical therapy school to go to graduate school. Most of them are 2.5 or 3-year programs.
What level of education do you specifically have?
I have a master's degree in physical therapy.
What school did you attend?
For my undergrad, I went to the University of Colorado, and then for physical therapy school, I went to Western University of Health Sciences. It's outside of Los Angeles.
Are internships or experience required to get the job?
To get a job, your internships are set up through your school, through your graduate school, so you'll have done all that during school. But to get into school, they require that you have a certain number of internship hours at physical therapy clinic.
What did you do specifically?
To have hours for that as well. So I did both of those things for almost a whole year before I applied to graduate school.
What are your hours or schedule?
Physical therapy is, because it's healthcare, it can kind of be all over the place. There's some places like nurses where they work 10 and 12-hour days. At our clinic, we all work 8-hour days, just different shifts. Some people work an early shift, some people work a late shift.
What do you most enjoy about this job?
The patients, helping the patients. Our clinic is very open atmosphere, so I really enjoy that. We can interact with the other therapists. All patients can interact with each other.
What do you least enjoy?
Probably paperwork. In healthcare, you have to do a lot of paperwork, a lot of charting, and it takes time away from, when you could be spending with patients, those type of things. So it's just not that enjoyable.
Do you use your profession outside of work?
We do, in that we do a lot of medical tent support. We do it at different types of tournaments, soccer tournaments to triathlons to, you name it, we've been there and helped out with it. So it's affiliated with our clinic, Rehab United, but we're out, promoting physical therapy out in the community.
What do you find interesting about your job?
Probably just, again, the patients, because we see such a variety. We see everything from pediatrics to geriatrics, sports-related injuries, neurological injuries. So just every day, new things, and it's always challenging. You always have to really think about each patient differently.
What would you change? Would you change your profession if you could?
No, I wouldn't. I really enjoy being a physical therapist.
Are there sacrifices involved in your job?
More just, not really. I mean, it depends on where you work and what kind of schedule you have, but all the events that we do on the weekends are all volunteer basis, so if you don't have to do it, if it's cutting into your life or your time, so it's, but there's probably some people that maybe work in a hospital setting that have to sacrifice their time a little bit more.
Okay. Do you feel that people in your position are compensated enough?
Yes and no. Depends on, again, where you work. If you work for big companies, big hospital corporations, a lot of times you might make a little bit more money and benefits might be better. Sometimes in the smaller private ones, if you work for a private company, you might not make as much. But, you have to wonder why people got into healthcare if all they're worried about is their compensation as well. So I think, if you enjoy your job, then you're probably compensated enough.
Would you recommend this job to other people?
Absolutely. Physical therapy, there's a huge range of things you can do. You're not stuck in one thing. Like I said, you can do from pediatrics to real specific things. Work with amputees, work with, brain injury patients. So it's a great profession that you can, kind of pick and choose where you want to work.
Do you think that your job is underappreciated by doctors, athletes, patients, whoever you're working with?
I wouldn't say underappreciated. I think there's a lot of education that needs to be done. I think there's a lot of doctors that don't know everything that we do and don't realize how much we know and how much we help our patients. So I don't necessarily think it's underappreciated. I think people just about how much we can do and how much we can't help and how much schooling we've had. A lot of people don't realize how much schooling we've had to do physical therapy.
What drew you to your profession to begin with?
So,
What drew you to your profession to begin with?
mostly, I knew I always wanted to do something in healthcare, and I wasn't sure what. And when I was in college, I went to an informational meeting for the kinesiology department, and I just really liked the study of human movement and biomechanics and that kind of stuff. I was injured a lot when I was younger, and there wasn't a lot of opportunity for physical therapy. Now we have a lot of young kids, which I think is great, because we put them on the right path. So I think that too.
Have you ever wished that you had gone for another degree in the medical field?
I used to, because originally I wanted to go to med school, but no, not once I got into the profession of physical therapy and saw how much we can help and how much time we spend with our patients. Whereas doctors are very limited on how much they can spend with their patients. I'm here sometimes too long maybe, but I feel like we can impact their lives more in physical therapy than doctors do.
What advice would you give someone entering your profession?
To do internships, volunteers at many different locations, so you get like I was talking about earlier, you can see the brain injuries or the amputees or just the sports injuries, or people who never thought they like working in a hospital end up loving it. So there's such a wide variety. You need to try them all out. Don't feel like you have to just do sports. You may find that you love another part of it.
What warning would you give someone entering the profession?
Again, that it is the healthcare field, and you have to hopefully be getting into it for the right reasons. It is a little, not wearing, but you just have to make sure it's what you want to do. That you really, are good at interacting with people and helping people. It's not just something you can get into, especially if you're just looking for compensation, if you're just looking for money, because it's hard. So just, make sure that it's really what you want to do.
Is your job what you expected it to be?
It is. I've worked at a few different places, and where I am now, it very much is. I kind of can set, where I want to be and what I'm doing, and the patients that I see, so it's pretty good.
What aspect of your job surprised you?
Probably the relationships, how you really do form relationships with your patients that can last years. We treat a lot of young kids here and they'll come back years later just to say hi or to check in, and that kind of surprised me the most, that we are impacting their lives so much that they'll come back just to let us know.